Hi, everyone. Thanks for joining us today. We're here to talk about rebuilding joints and relieving pain naturally. We've got some really great options for that. Let's see. The audio is on. It looks like I've got a message that one of our attendees can't hear. Can anybody else hear? Okay. All right. Looks like we have audio now. Thank you for bearing with us. Love the tech, right? So yeah, we're here to talk today about rebuilding joints and relieving pain naturally. There's some really wonderful options. Thank you so much for taking time out of your day. We wanted to start with just some quick polls to see where everybody is. So, of all the people we've got joining us today, how many of you have heard of regenerative injections, things like PRP, Prolotherapy, things like that? So we'll just give that a few minutes. And while that's going, it looks like a few of you have already messaged in, which we love. But if you're on your computer, you've got a chat box off to the right. You can always type in your questions. We'll answer them as we go along. If you're watching this on your phone, the chat box is below the actual presentation. So feel free to message in anytime. And okay, it looks like we've got a little bit of a mix. Some people have heard of the regenerative injections and some have not, which is really exciting because I think when it comes to joint pain, so often we think that, steroids are really the only option and they're really not. So let's go ahead and do one more. And that is, which one of these areas bothers you most? I know which areas that I tend to see and treat most often, but I'm kind of curious to see who all we have in the audience with us today. So, and obviously this is all anonymous. Yep, we've got some knees going. I'm dealing with a knee myself right now. Low back, that's another big one. Yeah, multiple joints. Yes. I tend to be a repeat offender too, especially our athletes or people who've just had some fun in their day. We tend to have multiple joints that are bothersome. The upper back and neck, yep, especially the more time we spend on computers. Shoulders. All right, we got a good mix here. I love it. So you guys actually hit on all the main ones. I would say the most common joints that we treat are knees, shoulders, lower back, and surprisingly elbows. There's a lot of tennis elbow, golfer's elbow, things like that. And yeah, I think most people have sort of multiple areas that they wish they could address. So thank you so much for playing along with our game. I love it. Okay, so then let's go ahead and get started. So just a little bit of history here. I have a huge interest in regenerative injections and pain management, joint treatment in general. In part, that's self-preservation. Those of you who know me know I like to water ski, I mountain bike. We do a lot of things with high potential for injury. I played volleyball for a lot of years. And my family's the same. They've all got this little streak of crazy running through them. And so it's a handy skill to have when yourself and the people you love just tend to get injured a fair amount. So I started doing injections really as soon as I could in medical school and in practice. I've got now 16 years of experience and have seen us go through several generations of regenerative injections. It started off as just plain old prolotherapy, which is kind of the oldest term we have. And those injections were just as simple as a little bit of anesthetic and sugar water to kind of irritate the joint. And it worked, but you had to come in very often for treatments, and it was a long, drawn-out process, and it just took a while. And since then, it's really kind of matured and advanced, and we've got some really fantastic options these days. And so the most common causes of chronic pain, us here in naturopathic medicine, we're all about drilling down to the root cause. Now, some of it's injury-based, obviously. You've got things like instability or loose ligaments. Sometimes that's just from an old strain that never quite snugged up the way it should. For a lot of women in the low back, that's something where after childbirth, the pelvis doesn't quite go back together. Some people are just hypermobile. That's me. My joints are a little bit more flexible than they probably should be for their own good. There are partial tears you can get. There's just plain old arthritis, wear and tear over time. There's overuse tendonitis. We see a lot of that in the wrists and elbows and knees, especially in runners and jumpers. Amazingly enough, a lot of chronic pain can be either caused or worsened by hormone deficiency. I can't tell you how many people, once we get their hormones corrected, a lot of their aches and pains go away. And the same is true for hypothyroid. When you're hypothyroid, your muscles tend to really seize up, and then that pulls on joints and nerves and things in ways that it shouldn't. So anytime you're dealing with chronic pain, you want to make sure your doctor's looking for those things. And then especially in the desert, dehydration is when we see a lot of, your body's really smart. You need enough water to keep your blood circulating and important things like the heart and the brain working. And if you don't have enough water in the blood, it's going to start pulling from less important areas like your joints, right? So making sure you have enough water on board is pretty critical. And then obviously there's chronic inflammation or immune activation. So if you've got chronic infections, or if you're eating a food that your body is sensitive to, it can cause some pretty widespread pain. And then this last word, hysteresis, is a fancy medical term for one of the docs I work with called it the slow creep, which is basically what happens when we sit too much, when we're not active, when we're not using our bodies, moving our bodies. The less we use them, the more everything just kind of gets stiff and brittle and achy. We've got a question here. Can we do feet and toes? Absolutely. They tend to be a little bit more sensitive for injections, but they respond beautifully well. Feet, toes, ankles as well. Okay. So then steroid injections. Most of my patients who have pain have had at least one. And, there's a lot to love about steroids. They do a really great job of turning off the pain and the inflammation, so you can get some pretty instant relief, which, is helpful for some people. That's what they need to get into PT and to start doing the exercises they need to do. But what people tend not to know is that steroids come with a really kind of dark underbelly. They send your risk for arthritis through the roof, even after just one injection in the joint. It tends to degrade it, degrades the cartilage. It can really muck with your hormones and your adrenals. And it can cause some tissue necrosis. Like we see in this picture here, this lady's got a little divot in her arm where she had some steroid injected there, and the tissue died, right? And so then you're left with scarring. Can also cause weight gain, which I know most of us would rather, run and hide from. So you really, as much as possible, want to avoid steroids. It's certainly not a long-term solution. So if someone's recommending that you get steroids over and over throughout the years, start looking for alternatives. And so PRP versus steroids in terms of pain control, pain relief. You can see here, this is pain on the left side versus time on the bottom. And cortisone or the steroids, you do get this initial pain relief, and at first it might even be better, but over time, and I don't know if you can see my here, but I'm just following this green curve, over time the pain comes back, right? With the PRP, we're actually rebuilding and regenerating the joints. So while it might take a little bit longer to get you there, over time, your pain relief is going to be better and better. That's this purple line here. So over time, that pain just continues to improve. Each injection of PRP, you get a good 7 to 9 months out of healing for just one go round, which is really pretty amazing. The other thing that we always have to worry about with steroids is there are possible reactions with other medications that you're having and, interfering with the other hormones. There's always the chance that you're going to have a bad reaction to medications in general, including steroids. But more importantly, it's just a Band-Aid. You're not actually healing anything. You're just getting some pain relief. All right, so regenerative injection therapies, and this is what really sets us apart here. We talked a little bit about prolotherapy. Now, all of these types of injections fall under this regenerative umbrella, which means that we're using them to actually rebuild the joint. We're using it to regenerate cartilage, to re-knit a partially frayed tendon, or to snug up that loose joint so that you can have function back. So prolotherapy, it's really been around since the 1950s. It's not done a lot in the conventional world because it's, quite honestly, it's not as exciting or as high dollar as surgery. And it does tend to cause an initial flare in pain, and then you have to do it every week for several weeks. And most people just aren't game for that kind of thing. It's time intensive, it's painful. It does work. Quite honestly, I really don't do traditional prolotherapy anymore, just because PRP is so much better. And so PRP stands for platelet-rich plasma. And, you know, as little as 20 years ago, it was really in its infancy, and it was in this place where it was like, hey, we think we can do this someday, and wouldn't it be cool? And we've watched it over time really mature into, yeah, we can do that, and it's better than we ever imagined. And so basically what you're doing is you're pulling your own blood out, spinning it down and pulling out all of your healing stuff, your whatever free-floating stem cells you have, growth factors, cytokines, all of the things that your body has to rebuild and repair. And then we concentrate them down and we inject them exactly where they need to go. And that tells the body, hey, we've got something to repair here. And so not only does the injection repair, but it also signals the body, hey, we've got some work to do here. So the effect you get is extremely potent. And I would say, you know, the clinical outcomes with PRP, one single PRP treatment is probably on par with maybe 10 or 20 of the old prolotherapy treatments. And so I'm a huge, huge fan. Beyond that, I would say just in the last, you know, maybe 5-ish years or so, we've gotten a lot of publicity surrounding stem cells. And people use stem cells as kind of an umbrella term. There are a couple of different ways that can be done. Now, there's amniotic allograft or exosomes. And if you are pulling something in the stem cell family out of a vial, like it comes in a little tube and it's drawn into a syringe and then injected, that's what you're getting here. Exosomes come from, there's a layer of cells in the placenta that can become virtually anything. They're extremely potent, almost kind of miraculous in a way. And so we get these things from, say, women who have had C-sections, babies born safely, healthy. Mom says, yep, don't need that placenta anymore. They sign it off and then they can go in and collect these cells. So there's really no ethical concerns, but they're extremely effective. And very often we'll tuck some of these in with the PRP, especially with our larger tears or bigger injuries, and it just turbocharges the whole process. Actual stem cells requires another medical procedure. Either you're harvesting bone marrow, so they're pulling that out of your bones, or they're doing a little bit of fat harvesting. So it's a little teeny bit of liposuction and they're pulling the stem cells out of that. It's far more invasive, far more expensive. And so, you know, that's not something that we've kind of branched into at this point. So then, what do they all have in common? All of these things are stimulating repair, regrowth, remodeling, so it'll break down scar tissue and rebuild new healthy tissue. It signals the body to send in new stem cells, and it can actually help kind of balance inflammation. So for people who are bone on bone and they're flared up and extremely painful when they come in, oftentimes that just calms right on down. And then over time, obviously, you're going to reduce pain. So, and then I apologize, my little picture's over it, but this is really very non-invasive. So you're maintaining your own anatomy, your own function. We're not forcing the body to do something. We're rebuilding it kind of back to factory settings, if you will, right? And so it fits really pretty seamlessly in with your day-to-day life. There's not a lot of downtime and that kind of thing. So PRP, what it looks like, basically we are harvesting blood, and this is something that's done in orthopedic clinics now, some of the more forward-thinking places. Mayo Clinic does some of this. But basically, when you pull the blood out, you can spin it down into different sections. This red part at the bottom, that's just your red blood cells. We don't need those, so typically they get tossed. The yellow part at the top is the plasma. That is sort of the carrying solution, and we can leave as much or as little of this as we need. And then that little white strip in the middle, that's where all the magic happens. And so we make sure that this gets very well separated so that you're getting the most kind of bang per treatment. And so there's good and bad PRP. I love this picture. I'll just eyeball it. I have people ask me all the time, well, there's this place down the street for me that'll do PRP for $200 or whatever. And the reason there's that big cost difference is because some PRP is just, they're kind of guessing how much platelets and that kind of thing they're going to get. And this is fantastic for osteoarthritis. We just got that quick question. Is it good for arthritis? And yeah, it's amazing. So in those less expensive treatments, they're just drawing the blood into the same kind of tubes that you would use for a blood draw and eyeballing it. Now, this works for areas that are less critical. We very often do it that way for aesthetic types of injections. When it comes to joints, though, you really need something that's more potent. And my patients I know who have gone elsewhere because they wanted to pay a little less, ultimately they end up having to do multiple treatments to get there. Whereas with the more potent kit, the majority of the time, I would say it's kind of one and done. With more severe injuries, it might take two. The only time really that I've seen it take more than that are those cases where we're just sort of holding things steady. And so a really great example of that is bone-on-bone arthritis. If you've gotten to the point where you have no cartilage to rebuild, then you do need to treat pretty regularly just to keep that inflammation down. I have several patients actually who do that just because they don't want to get their knees replaced. So they would rather come in, get a PRP injection once a year or so and, kick that can down the road. So now if you do have some cartilage left, then you're probably in that, 1 or 2 and then you're good zone. Let's see, and there is a really great question here. One caution that I would give you, and actually let me back up my slide here, is the one variable that we can't control is how potent your blood is, how many platelets you have, how many growth factors you have. And so when we're talking about what to expect from a treatment as far as results, the younger, healthier person is going to have a much better outcome than someone who's maybe not as healthy, who's got some other conditions going on, or they're older, just simply because we have no control over the potency of your own blood. Okay, so let's move forward here. These are the PRP kits that we use, and we love them because they've gone through some really extensive research and development. I mean, right down to what material does that little cartridge need to be so that it doesn't damage any of the cells. It's really tailored to very specific uses. It's a much higher yield. Right now, this is the best that we know of for joints on the market. And, that's something that we as an office stay on top of as well, because we've learned so much about PRP over the years. Every now and then a new method comes up, a new technique. And so we're working hard to, make sure that we're always offering the best. Right now, this is still it, but if that changes, obviously we'll let you guys know. All right, and so what to expect? If you come in to do this, it's your basic blood draw, just like if you were doing labs. So that part's easy peasy. And then the sample takes a good 15, 20 minutes to spin down. And then from there, we prep it into a syringe and it gets injected in the appropriate areas. Now, you all know I'm injury prone, or maybe some of you know, I've had this done for myself a couple of times, and I can tell you that the actual poking and injecting is no big deal. Like most things, thinking about it's way worse than it actually is. The solution is a little bit stingy, but we put anesthetic in it so that, it's short-lived. You end up, nice and numb by the time it's done. So, and we use the smallest needle possible, so that makes things nice as well. Then because there's that little bit of anesthetic in the solution, you get that numbness for a good 30 minutes to an hour, maybe 2 hours, just depending on how quickly you clear it out. And then you typically get a bit of a flare in pain. And so I always recommend that people do this when they can have themselves a little bit of downtime for a day or two after, where they're not, you don't want to inject and then go walk Disneyland or go camping, right? You want to be able to just have a movie day if that's what you need. And so it's short-lived, and good things are happening. That flare and pain, that's because your body has been told, hey, send all of your healing stuff here. And that's what's happening. So I think it's, at least for me personally, I know it's much easier to manage when I know that it's going to end soon and that good things are happening. And then because that's all good things, you want to make sure that we're not shutting that down. So no ice, no anti-inflammatories, ibuprofen, that kind of thing while it's all flared up. You can do heat, and we do, you can do Tylenol, and we can prescribe pain medication if you need. Some people need, some people don't. That's just a very personal thing. Then after the injection, your body's going to be laying down new fibers. And so you want to really give that time to settle in. Very much like overseeding your lawn. You don't want to walk on the new baby grass before it gets a chance to really get established. If you've got a partial tear, like say a labrum or a ligament, if it's only, this strong, you don't want to put a load on it and just break it. That defeats the purpose. You've got to wait till it really gets very well knit before you put a load on it. So we keep the activity level nice and low for a couple of weeks. Regular day-to-day stuff is fine. And then typically speaking, by about the 4-week mark, that's when I release people to go back to their exercise and that kind of thing. And so the pain relief every now and then is instant. More often than not, I'd say it takes a good 3-4 weeks. This process takes time, but it's worth it. And so the bulk of those changes are going to happen in the first 6 to 12 weeks. Typically around 12 weeks is when we reevaluate. How are you doing? Do we need another one? Are you good? And then we just let you rock and roll, right? But you're going to see continued benefit out of that one injection for a good 7 to 9 months. So here are some really fantastic results here. This is 8 weeks. This is before PRP. Now, just because you might not know, what we're looking here is the space between the joints. And again, I'm not sure if you can see my little mouse or not, but the knees on the left, you can see there's not much of a gap between the top bone and the bottom bone. And they've even put measurements there on how many millimeters. If you go over here to the knees on the right, you've got a much bigger gap between the bones. And that means that only happens when cartilage gets regenerated. And once those bones, if they're not grinding on each other anymore, it's not as painful. This is painful, this is not. So we've got some really good evidence here of rebuilding cartilage. Now, the caveat to that, you have to have cartilage to rebuild, right? So if you don't have any cartilage, if you are bone on bone, our big goal there is just to buy you time, buy you pain relief. And because we're just injecting your own blood, we can do that as often as you like. So really, you're in the driver's seat there. All right. Here's another really great example of knees where this red arrow is on the left. You can see how there's kind of a gap. There's not much of a space. And then over here on the right afterward, we've got a really nice gap here. So lots of good repairing and rejuvenating happening. This one I love because this is the Achilles tendon. If any of you have ever torn or injured your Achilles, you know how difficult they are to heal. They don't have a lot of blood supply. It just takes forever. And this type of injury is very common in people who run or who hike. And to tell them that they can't run or hike for a year is like devastating. Sometimes this can happen with people who have bad reactions to cholesterol medications. But in this top section here, this is basically if they have taken slices through the Achilles, you can see there's these like black pockets, these holes. Those are all areas where the tendon has basically degraded. And if those holes get big enough, you're at risk for the tendon just absolutely rupturing. And so this is from a woman who's 55, high BMI. I mean, she's a little bit overweight. She's got some high-grade degeneration. She tried physical therapy and an immobilizing boot and no help. She did PRP, and here we go. So all of those little holes are gone. She's got a nice normal Achilles here. So we really can regenerate your tendons and ligaments very beautifully. With things like labrums, if it's a complete tear through the labrum, odds of that making its way back together to reknit are smaller. But if it's just a partial tear, reknits beautifully, really beautifully. All right, so here's some hip. Again, we're looking for those gaps between the bones, between the cup of the hip girdle and the leg bone. On the left here, you can see there's not much of a gap. On the right, a nice big gap. So some good cartilage repair there. So this would be for arthritis of the hip. And then here, a patellar tendon, if any of you have jumper's knee, just like with the Achilles, you've got this black kind of degraded spot on the left and a much healthier looking spot on the right. Now that's just one injection and that's 9 months post. That's pretty darn great. especially if we're avoiding surgery in these cases, right? That makes it even better. And so just a couple of kind of personal cases here. I saw a gentleman, 45, really severe arthritis in his hands, which was a real problem because he worked as a nail tech. And so very detailed work, very fine skills, and a lot of gripping. It was extremely painful for him, and he just didn't have room in his world to take any time off work, was told he had to have surgery. He tried steroids, they didn't help. We did one injection. One hand, totally fine, 60% on the other. So we gave it some time, and 3 months later he came back. He's like, no, this was so great. I want to finish it up. So we did a second treatment, and both hands were 100%. It was really remarkable. Then this case here was a 64-year-old lady with low back pain, sacroiliitis. So where that sort of red ball is up at the top, this is right where sort of the hip and leg meet the low back, right at the top of the behind there. And it's a really common joint to injure because basically it's the joint that holds your entire bottom half to your top half, and it's just held together by a bunch of ligaments. And particularly for women with pregnancy and childbirth, it gets kind of stretched and then it has to make its way back. And so this particular woman was having some really significant pain. She couldn't sit for any period of time. She had a hard time driving in the car. It was shooting down her legs in that classic kind of sciatica pattern. We did one treatment and her pain was completely gone in less than a week, and she was able to drive to Vegas. And this story, I would love to tell you that it was kind of a miracle case, but it's really not. This joint in particular responds beautifully well. And we've had people go from, not being able to watch a movie with their family or not being able to get on the floor to play with their kids to fine. Then this one's a 58-year-old lady, had some tennis elbow, so severe pain on the outside of the elbow, very, very common. She went in to see her orthopedist, had an MRI done, and those ligaments were just shredded. And it was a combination of overuse, tendinitis, and then a fall injury. And so those already inflamed tendons just gave out when she fell. And that she had, quote, extensive tearing of the entire complex. So it was really pretty significant. Her orthopedist told her her only option was surgery, and even then it was only a 40% chance that it would help. She came in, we did one treatment, pain went away completely, and she was back to using it like normal in 8 weeks. Then a couple months down the road, some of the pain came back, so we treated again, and I haven't seen her in a long time. And actually that long-standing tendinitis also cleared up, which was a really nice kind of side perk for her. All right, now this is a patient who's got some scoliosis and mid-back pain. So that curve in the spine, this is not her, it's just an image pulled off the internet, but you get the idea. Now this is a structural change. Her bones aren't gonna shift as much as we wish they would. And so she had significant pain. We did one treatment and she was able to go literally on safari. So bouncing around in the wilderness in a truck, no back support. Without any ibuprofen, which was really remarkable. And she had far, far less pain for a good 9 months or so. And then, came back at that point when the pain came back, we treated again, same result. In a case like this, very much like the bone-on-bone arthritis, we would expect to kind of continue to treat periodically over time. And because, the bones are still going to be curved no matter what we do. And that's okay, right? This allows her to live pain-free and to not take pain medication and to be able to do the things that she wants to do. And so, that can be worth it in a lot of cases. So, again, your other aggravating factors, you just got to make sure that these things are all in place. Hypothyroid, hormone imbalance, stagnation, that's that hysteresis where you're just not moving, your blood's not flowing, you're not getting good nutrients into the area, dehydration, muscle instability. Okay, now this is a really important one. I'm a big believer in physical therapy. For an awful lot of people with back pain, they can do some core strengthening work and their back is going to get much, much better. And, for most of us sitting in a desk, our cores aren't exactly getting stronger. They're getting weaker. So making sure you've got good muscle balance and good muscle integrity is really pretty key. And then one other thing that can be a real issue are adhesions or scar tissue. If you've got scar tissue locking something into a position it's not supposed to be in, then you've got to get that broken up so that things can move normally. And so, if you need to do anything with all of those, we would cover that in a consult or a visit because every case is unique. So thank you so very much for your time. If anybody has any other questions, please go ahead and pop them in the comments section. And we tried to make this really kind of quick so it wouldn't take up all of your lunch hour or all of your day. Our big offer for the day, let me go ahead and pop this up here, is we are going to have a free joint health consultation. So if you're listening to this and you're thinking, holy moly, yeah, I think this might be a good fit, give us a call. We're happy to sit down and chat, no charge, to see, is it a good fit? Would we expect you to have a good result? What can you kind of expect in terms of what treatment you might need? So that little special offer box there, you can click, it'll take you right to the website. You can call and schedule. And so hopefully this helps. I'm a big believer in people being able to live, pain-free, right? You need to be able to stay moving. If we want to talk about quality of life and longevity, movement and exercise is where it's at. So thank you very much for spending your time. And let me just look and see if I can toggle back here. Okay, so good. Some other great questions. For wrist tendinitis, PRP does work. Now, I can tell you, actually, this just happened a week or two ago. I had somebody come in and say, I've got some wrist tendinitis and I'm thinking about PRP. And in that particular case, now this might not be true for everyone, but in that particular case, I said, we can certainly do PRP, but I think you might want to try this other vitamin first and see if it doesn't go away. And it did. So in that case, we were able to save her from doing an injection. As much as I love to inject, if there's a better option for you, we'll do that. Then let's see. This is a fantastic question. How do we know where to treat? And do we do imaging? Now that really depends on the injury or issue that you've had. Most often, by the time people are thinking about doing something like PRP, they've already tried some other things, and so they have some imaging, and they bring that in with them. And yes, we rely on that pretty heavily to know where to treat. Now, that having been said, just because something shows up as being a little bit abnormal on imaging does not necessarily mean that's where the pain is coming from. I can't tell you how many people have come to me and said, I've got low back pain. They've done these epidural injections. I've got a bulging disc at L4. I've been treating and nothing's been getting better. Well, when we do the physical exam and start talking about where the pain actually is, turns out it's that sacroiliac joint and not the bulging disc. And so once we treat the SI, things get much, much better. You can go out, they've actually done research on this, just simply having a bulging disc does not necessarily mean you're going to have a problem. So they can go out right now, pull 100 people off the street, say, do you have back pain? If they say no, and we go and image them, a good half of them are going to have a disc issue. So anytime we're trying to decide where to inject, it's always part, what do the imaging say? And part, what do you say, right? What does your body say? Where's the pain? What are our exam findings? And you really have to mesh those two together. So this question specifically was about a knee, and that really does depend on which area is the problem. So in most cases in the knee, we're just going right into the capsule. And that's fantastic because then that bathes the meniscus, the cartilage, the ACL, the PCL, really most of the main structures. We might also inject underneath the kneecap a little bit to help. There's cartilage under there that can be problematic. Sometimes we treat the patellar tendon if that's where tendinitis is happening. There's a bursa right below the knee that sometimes we treat. So that's kind of how we decide where. And we can always order imaging if we need. So if it's something that you're thinking about doing and it's never been sort of properly evaluated, we'll get you an order for that X-ray or MRI or whatever the case may be. All right. So it looks like we have perhaps gotten all of the questions. There's some fantastic questions. Thank you, guys. I look forward to hearing from you if you've got something that's bothering you and just won't quit, or that old injury that just never quite healed up right. We'd like to get you past that. And we can answer all of your specific questions, you know, for you personally in that free consult that we're offering. So I hope you all take advantage of that and have a really beautiful rest of your day.